Good morning, MS Live. I'm your host, Dulci Hill, and let me just share this to Meerkat. Let's see, Meerkat. All right, and I also like to share this with, let's see, hang on. Secondary progressive. Okay, there's let's see. And you know what? I'm gonna share it one more place because I'm careful to share this. If I'm in your group and I shouldn't be, kick me out, or kick this video out. Again, we're not trying to step on anybody's toes. So let me just do that. All right, share and I'm done. Okay. So hi, Sharia. So let me see. David's with us. Chris is with us. Good morning. Good morning, all of you. You know what? I was praying. Gosh. You are Patricia. Yes, this is Patricia. But you know what? I saw David, and I knew you were Patricia. Just so you know, David is Patricia on YouTube. Right? Sharia is with us on Facebook, and that's huge. If you're on Facebook and you're watching this and you see this and you like it there, if you want to share in another group that you think it might help other people, again, I am nothing more. In fact, that's what I was telling somebody. This isn't my show. I'm nothing more but a bookmark, right? I'm a bookmark that promises that the books can be every Tuesday and Thursday at 11 o'clock so that you can come together and support each other. While and chat amongst yourselves, and this is primarily with YouTube. You chat amongst yourselves while I babble on. I'm the shiny object to look at, and you might comment about what I have to say, but I'll tell you, the more I do this, and the more. Yesterday I swam, and I'm going to take this in a slightly different direction. This is more for newly diagnosed. Uh, I taking this in a separate direction because yesterday I had I had a horrible day, but I still managed to lift weights. All right, let's see. You can see it rolled off and into the dirt because I did it outside. But I managed to lift weights following on YouTube. I have an exercise channel. Hi, Dennis. So I managed to do that. And then I had a 2 and a 3 o'clock appointment to swim at the pool. And normally I do 40 lengths or 20 laps around, I don't know, 40 lengths, 20 laps, and I do that. But I promised this guy that he got in touch with me. He is on the pivotal time of maybe being diagnosed. He has a lot of the symptoms, and he's scared. He's scared, and I forwarded some of my YouTube videos that's supposed to comfort, but I also real quick, Dennis, David is Patricia. Just so you know, that's code name. David is code name for Patricia. Just so you know. So anyway, I'm swimming in the pool, and I did 22 lengths or I did 11 laps, and I just wasn't having fun. Just a second here. All right, I'm looking at two people, just so you know. I'm looking at two people that are outside going for a walk by my front window, and they have masks. They have masks on. All right, if you are outside and you're walking, you're not exposed. You're the air. Hi there, Chris. You're not exposed. So anyway, I was telling you about me swimming. Right. Yeah, exactly. So anyway, I'm swimming and I stop at 11 because I wasn't having fun. And work is only work if you'd rather be doing something else. So I swam to the side and I held on to the side, and the head lifeguard came over and she said, "What's going on?" I said, I just don't feel like doing it. I'm not enjoying myself, and I could try push myself, but I'm telling you, my energy was low. Plus, I promised this guy that I'd call him by 3 o'clock or 3:30. I'd call him. So, hi, Jane. So, what I did was, I said, I'm not feeling it. She said, this is so good because you're booked at 3. If you get out at 3 o'clock, I'm off at 3, and then I can get in your lane reservation. So everything works out for good. I got out and I immediately called this gentleman who had so many questions, and I invite all of you who are watching this, if you are newly diagnosed or if you're looking at being diagnosed, write down a list of concerns and let me know. Then you can reach out to me, email me or text me or private message me your phone number and the best time to call, and I'll be a sounding board. I'll tell you what's consistent, what's not. I'm not a doctor, and nobody else is, so I'm not going to give you advice is to, over your doctor. I think you should go to your doctor. One of the things, his concern was optic neuritis. His future, he was worried about his future being a wheelchair. Again, if you've been diagnosed with MS recently, there is no reason to think you're ever going to get as bad as some of us have gotten with chronic progressive. The reason why is when I was diagnosed uh, back in 93, but it was back in the 80s, I think I had it. I had a very active, aggressive disease. There was only beta seron. There was only one medication. Then came 89 and let me think, 80, no, I'm sorry. Then came 94 and copolymer 2. It was Copaxone early, and I was in that study program. So there was 2 medications. So then Avonex came out a few years later. All these things happen. So now there is tons of medications. Now, the early medications only gave you a 30% chance of not having an attack. These medications now, Dietary, I'll start from the ones with the greatest odds. If you go to msfrontiers.org, hi, Richard, you'll see a list of in the order. It's an old-fashioned list in the order of effectiveness. And it's so huge. It is so huge. Okay, so it's good to to look at. It's good to look. I'm sorry. I just read something and it's like squirrel. It's got me all a little off track. So there's in the order on msfrontiers.org in the order of effectiveness. Now, just starting with Dietary, Dietary is 78% chance of keeping you from having an attack. Gelenia is high, is ridiculously high. That 78% is 40% more than the very first medications. Uh, uh, the very first medications we first had. So with that, and Ocrevus and rituximab, these things will prevent, you have even greater odds. The reason why I'm saying them is every chance of you not having an attack, these medications, disease modifying medications, they have, I'm on rituximab and there's no side effects for me. Hi, Rob. So what I wanted to tell you is that now, if you've been newly diagnosed, look into stem cell treatment, and you can email, you can discuss that. Go to, you know, I know people who have been so active with talking to me, newly diagnosed and have gotten stem cell treatment and have had the MS eradicated. Now, there's CCSVI, and it's so important that you must know that there is all over the world, people are saying, you come here, we'll take skin cells and we'll just introduce that without chemotherapy. That, and we'll charge you $40,000. That's not stem cell therapy. Stem cell therapy now, Russia, there's a few places that have it. You go and they give you radical chemotherapy. They've got to destroy. Excuse me. They've got to destroy your immune system before they introduce stem cells back to give you a new immune system without MS. Now, the reason why the protocol is that you can't have MS longer than, say, 10 years. You can't be in secondary chronic progressive. You've had to have this disease slightly, not very long. A couple other all right, so you can't have it very long. You can't be so far progressed that eradicating the MS is not going to reverse the damage. Also, the longer we have MS, the more it goes into dormancy. Not for me, but for most people, the statistics are there. The other thing is that you could never have been on Nivantrone. Nivantrone is a chemotherapy. It actually is a chemotherapy. It's not like rituximab. Hi, Josie. It's not like rituximab or Ocrevus, where people like to say it's chemotherapy. Those are not chemotherapy. Those are monoclonal antibodies. They don't kill the entire cell. They only kill cell clusters or cell designators. So, just every cell has, I believe it's 99 cell designators. It only kill 3 cell designator. That's not chemo. It's called monoclonal. Chemo was Nivantrone. It was a somewhat radical chemo, and it could affect your heart. So that if you've had that afflicts you, you're not allowed to have stem cell. So it's that There was another risk factor, I can't remember. But my point is that if you haven't had MS very long, the Cleveland Clinic just had an article out that it was the first guy who he's 50, turned 50, and he had MS for a short amount of time. Well, the Cleveland Clinic took him, and he is the first patient in this trial, this study program for people to get this medication, or not medication, to get the radical chemotherapy. So, and the a new immune system. So this is the future of MS. So, if you've been newly diagnosed, considering the medications to keep you from progressing 80% of the time, considering they're doing study programs with CCSVI stem cell, there is very the odds before, when I was first diagnosed, the odds were that 80% of us relapsing remitting were going to turn into secondary progressive. Now they can't even estimate the odds, because I think it's flipped. It's only 20% of people with MS will progress because you got this medication. To answer your question, Patricia and to Chris, the ones that the people I know who've had this done, who have had relapsing remitting and had this done successfully, have gone to Russia, have gone to, I think it's Moscow, but that is the place that everybody I know who has had this successfully done has gone there. The Cleveland Clinic in Ohio, if you want to follow what they're doing, again, it's the Cleveland Clinic in Ohio. So all you have to do is Google Cleveland Clinic and Cleveland Clinic and stem cell. Cleveland Clinic and stem cell. I have to be very careful about recommending places because I'm not a doctor, and you guys have to research a little bit on your own. I can point you in the right direction. Also be very, very, very careful, because I'm telling you, we've got MS, we have victim, we have desperate tattooed on our forehead. One of the things that years ago, probably 4 or 5 years ago, one of my dear friends, she also has MS, as long as I've had it, she came into a state, and she said, I found a place in Mexico that'll do stem cell therapy. Let's hold hands and do it. Then she says, I'll pay for you to have it. So I thought about that, and then I did the research, and I started thinking about that, and she later called and she says, I'm not brave enough to have it done. I'll pay for you to have it done, and I'm going to fly down with you. I'm telling you what, this here, I did the research, and it wasn't the stem cell therapy that they wanted $40,000, and it wasn't going to be the stem cell therapy that had good results. Let me see. Let's see. Richard said, I've had too long, probably too expensive. Yeah, well, the other side effect, Richard, the other problem that we face when we have MS this long, and the older, that's right, you can't be over a certain age. And the reason why is because, remember, it's radical chemotherapy. They got to kill your entire immune system. The chances of you dying from the chemotherapy are greater than possible benefit. Remember, if you're not walking well and they eradicate MS, you're not going to walk better. This is what I've read. However, there are trials. If the key, I'm who am I? There are trials that say there's medications. We're at a point. There's medications that help restore. We're looking for nerve regrowth. That's our hope. All right. First of all, when you have relapsing remitting, what you look for is you look for myelin repair. To protect your immune system. The best way also when you take the medication is to eat anti-inflammatory diet. You've got to put your body into a situation where you're not running with inflammation. And it's so huge. That is huge. No sugar, no, you got to do that. It's not fun. The second thing is that when you start getting demyelination and you're not secondary progressive yet, you've got holes on your nerves, you want myelin repair. You want to put Band-Aids. You want a chemical Band-Aid over the insulation so that nerve doesn't get brittle and break when you're secondary progressive MS. And I say that this is what you want. So when you're later relapsing remitting, you want myelin repair, and you Google that. This is this is how I've gone along in my progression on research. When you are like Richard, or like Jane, or like Chris or Karen, when you have gone into secondary chronic progressive, and now you're suffering some difficulty, permanent, like me, I cannot lift my hip flexor. Can't do it. Can't do it. That connection down my spine to that hip flexor doesn't work. So I use that hip flexor system to flex. When that doesn't work, my hope is in nerve repair. It's like Christopher Reeve, think when he fell off the horse and he became a paraplegic, and people with spine injuries, they spend so much money and time on trying to figure out how to make these quadriplegics walk. It's all nerve repair. That is our hope when our bodies are not effectively communicating. We need new wires. That's where I'm at. I don't need to eradicate the disease because the medication keeps me, the rituximab keeps me from having attacks. So that's a good thing. I probably will be on that for life. So that's a good thing. What I need is, and myelin repair is pointless, right? I don't care about myelin repair anymore. I just want the nerves that are no longer hooked together because they've been exposed so long, they've gotten brittle and they snap, right? It just, in relapsing remitting, when you have these nerves and they come apart, right? They have little holes in them, right? You can, on the other side, there's no hole there. So you can actually rehab yourself to move your legs. You can do this with relapsing remitting. So it's so important, Patricia. It's so important for people who have been newly diagnosed to rehab, to get that going again. If you get that going again, if you keep your body in the greatest physical uh, uh, the greatest the greatest physical condition, then your hope is myelin is all right, Al. The best med for MS is something you need to talk to your doctor because we don't know your body. Go to msfrontiers.org, look at medications, and it's listed. The medications for MS is listed in the order of effectiveness. So I would go there, msfrontiers.org. Uh, Ocrevez is one of the hot. It's you know what you're on one of the best. The monoclonal antibody that's what Ocrevez. It's not chemo. It kills two cell clusters or I'm sorry, three cell designators, and that's good. That's good. So how long have you been diagnosed? Al or AI? AI. And what's your name? AI. I don't know about calling people AI. And you know, Chris, let me tell you something. I was on Dietary for 6 years. Dietary was my favorite. Drew, oh, okay. Drew. That's right. That's right. I was on Tisabri for 6 years. I loved it. Tisabri is the only medication that'll make you feel about 10% better. Not with everybody, but with it's the only one that's reported. Some people uh, claim that they feel better, and I felt better. I felt so much better that after 3 weeks, when it was starting to get time for my next infusion for Tisabri, I swore my brain felt like I needed it. I needed. I'm not feeling this good as I got to get my Tisabri fix. Uh, uh, and that is huge. That is huge. Uh, okay, so that is huge. To Sabri, that was I think 78% effective. I love Sabri. They took me off Sabri for a number of reasons. There are three factors that increase your risk of PML. PML is the brain disease, and one of the things that first of all, people are afraid of Tisabri because of PML. This because it shows that one in 1,000 runs the risk of getting PML, but there's factors that increase your risk. By the way, I was in that Tisabri study program uh, way back when. I was in that program, and going into another. I'm doing the bile study program, so for the future of that. But what the factors that increase your chances is if you've been on Tisabri long term. The longer you've been on it, the more you're at risk of getting this. The second thing is if you have ever been on Nivantrone, that chemotherapy I talked about, it's navy blue. It's kind of scary when it goes in your vein, but that's real chemotherapy. Uh, the third factor is JCV positive. If you're high there, if you're JCV positive, and that's a virus. But you know what? Now they've changed it. So if you're JCV positive and you don't have any of the risk factors, they can keep an eye on that. It still doesn't increase your risk of having this. So so it That's huge. Now, Johns Hopkins, I was on to Sabri. My neurologist took me off of Tisabri and insisted I go on Gilenya. Um, it was it was so upsetting. My chances of getting with me having JCV at the time positive, uh, having Nimontrone and being on Tisabri for 6 years was increased my risk factor to 3%. That's 3 in 100 chance. I said to the neurologist, because remember, I felt better. So that's a 97% chance that I'll be fine. And not 1 in 1,000. That is, that. And I said, I want to stay on it. I want to stay on it because 97% chance of me being attack free. I want that 10% feeling better. They didn't give me the choice. He says, well, it's not going to come from me. Johns Hopkins is not going to we're not going to be responsible for that 3% if something happens to you. If PML is terrible, but guess what? PML, if you start having symptoms of PML, you call your neurologist right away. They can reverse it. This is the next day, and it's similar to a MS attack. You call them often, and you know what? It's yeah. So as far as I'm concerned, Tisabri, I'd rather be on Tisabri than rituximab. And the reason why I say that is because I don't have side effects with rituximab, and rituximab is once a year for me, and it's effective. But what I like, and so I'm not there. I'm there 6 hours once a year. I would so much rather go every month and get my go-go juice. That's what I call it, go-go juice. PML, all right, all right, you guys can describe what PML is to Patricia. PML is a brain disease that if you don't catch it, will make you a vegetable. It attacks your brain. It's a virus of the brain. And that killed early on when I was in that program. See, I was on what was I on? I was on no, let me see. I was in the study program, but I was also on Avenex. And they stopped the study program completely because people died. That one person, I was in California, one person died, and they traced it to this person having other risk factors, having Crohn's disease, and being on different medications. So was that a factor? And they didn't know PML until it was way too late. Yeah, and Dennis is right. Yeah, Abagio. But Dennis, if you go to msfrontiers.org and you look at medications, you can look at the Abagio effectiveness and then go down and look at the ones that are more effective. Right now, I believe Abagio is a first level medication. Before you can go on these fantastic medications that hold you at bay, what they do is they want you, and I don't know if this is true, but before they wanted you to be on the ABCs, the first line medications, Avenex, Betaseron, Copaxone. They wanted you to do that. But now I'm in touch with the MS community. So many of you with MS, and you sent me emails, questions. Occasionally, I talk to you on the phone. when when you've been desperate. I'm here for you guys. And when I think about that, I look PML. They didn't know about PML, but in the first level, they're taking people with MS and they're putting them on they're putting them directly on Ocrevus now to Sabri. They're jumping that because they see that it's so effective. By the way, if you're on Medicare, or if you can, only Medicare patients, I'm sure other insurance, but Medicare in the United States, Medicare patients uh, can get rituximab as an off-label treatment for MS. Uh, let's see. Yeah, catheters. All right, Andrew's asking about catheters. Does catheters cause cancer? I've not seen anywhere that catheters cause cancer. I've seen that cell phones to your head can cause cancer. I've seen microwaves can cause cancer. I've seen uh, not washing off the pesticides off of our fruits and vegetables can cause cancer. You know what? I've seen uh, saccharin, the pink artificial sweeteners can cause cancer. Everything. You know what? I think breathing. I just had malignant melanoma completely removed off of my shoulder. So the sun, vitamin D, the sun can cause cancer, but not being exposed to the sun can cause MS. We need vitamin D. What is it? Vitamin D. Too much sun causes wrinkles. Not enough sun. I don't know. All right, we're not feeling this well. So all right, all right. You're asking about pain, Andrew. You know what, Andrew? I know who you are. We talked. You've got back pain, right, Andrew? You've got pain associated with your back. Tell me if I'm right. Are you the person I talked to? Yeah, yeah. Exactly, Andrew. All right. Yeah, you know what? I see your post all over Facebook uh, about does medical marijuana work? Does Lyrica work? Does gabapentin work? I see you looking for a pill. I love you more, Andrew. I see you looking for a pill to relieve what is muscular, what muscular. So what I don't know how to get this, just to express this. Every one of us, and I'm old. I'm an old lady. I know you're a young lady. Or a young dude, right? So don't let the hair dye and the wrinkle cream fool you and the teeth bleach. Don't let it fool you. I have lived long enough to know that I'm a pill gal. There's people who say I don't like medicine. Not me. I love pills. I have taken medicines right when I was diagnosed. I've been aggressive. I like pills, but let me tell you something. There are pills that don't work. I know I've got terrible shoulder pain and it's my fault because I swim before I warm up my shoulders. Right? I gotta warm up my shoulders. You know, Otherwise, it's my fault when that hurts. I've got bursitis, terrible. It's not bursitis. I've got hip pain because I don't walk right. I walk straight leg, and it's my good side that ends up hurting. Right? It's my fault, Andrew. It's my fault because if I don't exercise, if I don't do some sort of strength training with the pains my body has, that a weak body is a painful body, right? The stronger your back is. And by the way, I had such a bad sciatic. I'd been dealing with sciatic for the past, I'd say the past month. And I'll let you know, those of you with MS, well, no. Anyway, well, you know what they say, 50 is the new 30, right? Or in your 50s. Happy birthday, my mom, because she is at a huge birthday, monumental birthday. So, and I'm not allowed to say that, I'm sure. But I gotta say, but I just have to say, Chris, you can give Drew advice. Uh, Thank you. Thanks for looking, Jane. Abaja is 47%, and that's still a huge amount more than beta serum ABCs. And I just thought, because I used to go to all the pharmaceutical. Whenever a new medication comes out, I go and I sit and I learn about it so that I can report what they say. It just okay. So right, all right. So you know what, Patricia? You know what? 47% effective was huge back then, but 78% effective. Again, you just don't need if 47% effective works for you for a number of years, it could work permanently for you. It just so you don't have to use, say, a tourniquet if a band-aid will work. Uh, um, and what I mean by that, band-aid, think about Aubagio as a band-aid, and think about stem cell therapy as a tourniquet, right? You just, because you run the risk of dying, and it's more so. Now back to you, Andrew. Is that I was talking about the sciatic? We people with MS can handle pain. Most people with the sciatic pain, it drops. They have to sit. They have to. What happens when we have a sciatic pain? It's like, oh, sciatic, and then you keep going. But I'll tell you, I've got a bad back unless I do back exercises. The MS, I have a playlist that's exercise that between that and then Bob and Brad is physical therapists. I do a little bit of that, a little bit of the exercises I know. If I don't do things for my lower back, oh my gosh, it causes pain. I got to spend that much time on my shoulder, my hip. Um, because it's when it gets to the point where you need a steroid shot to reduce the inflammation. Uh, you haven't answered enough questions. Like you should ice. Like I have to ice things that reduce the swelling. All right. Let me see. Okay, I have to read. No, let's see. No, it's not going to work there. Never let people convince you that you are sick. We have MS. Plain and simple. That's true. We don't need uh, uh, additional names to a pain. All right, Dennis, you started Abaggio 4 years ago, had MS almost 30 years. His arms and his hands still work pretty good. I want to hang on. to that stuff that still works. Had no new symptoms since starting Abagio. And that's wonderful. It is working well for you. Again, this Band-Aid is effective for you, so there's no reason to get a tourniquet. You don't have to go the next level. All right, let's see. And Gina is saying we compensate all day for our bodies' weak areas and end up causing pain in real bad ways. And I'll tell you, Gina is our resident nurse. I don't think I ever said that, shared that before. And Andrew, what do you? Botox helps for bladder. Botox helps for severe spasticity. Botox does not help for pain. So, does Botox help? That concerns me, Andrew, because you're asking about more medications. Uh, that is. I'd like to see you do some physical therapy. All right, you did it for bladder, it didn't work. Again, do you have a it's called a neurourologist. I have this special neurourologist, a urologist that specializes in bladders that are affected because of neurological reasons. Gina really helped me because she suggested a medication that I hadn't considered. And I brought it, right? I didn't take her word for it, but I brought it to my neurourologist and I said, what's the story about this? So she put me on the medication. It didn't work, right? Because it worked on two different areas, she put me on, she says, no, you take this with your other medication. And it's working. There's the new norm. We have to respect the new norm. Uh, Again, Andrew, go to Bob and Brad's physical therapy on YouTube and Google. Search for physical therapy for lower back. One of the things that I do with my exercise videos is getting down and standing up. Why can't people do an exercise video where it's all standing up, and at the end of standing up, then you get down on the floor and you spend the rest of the time on the floor? I don't like exercise videos that are down on the floor, stand up, down on the floor, stand up, because I have to hit pause, and it takes me uh, more time to stand up. And I call it exercise. I said, all right, this is exercise. I got to stand up. But no, forget it. That is not what I want to do. So I look for videos where it's all standing up, and then thank you, Chris. Then it's all, it's all down. Tim, thank you for the time check. 10:48. All right. So Andrew, as far as rehab, physical therapy, Bob and excuse me. Oh my gosh, I'm a hot mess. But go to Bob and Brad's physical therapy and Google what you're having pains, and they'll show you. Thank you. Bless me. You know what? All right, squirrel. But anyway, that's so. Look at that physical therapy. Look at the MS rehab exercises on the playlist, and definitely consider that. By the way, YouTube, Sharia is on Facebook. All right, so uh, this really helps cognitive focus. I read that, and I'm supposed to read that and say hi to everybody while I stay on topic. Oh my gosh. All right, so I've got a couple things that I wanted to read. Uh, just, and I'm going back to God because just because you know what? It doesn't matter what anybody believes. Where I get my strength and where a lot of people get their strength is through Christ. A lot of the subscribers there. So I just wanted to tell you a couple verses. Matthew 28:20 says, "When I'm lonely." This is when you're lonely. Remember, you're never alone because Christ promised that he'd always be with you. And that promise is in Matthew 28:20. And if you're worried about anything, imagine him saying, "Let your heart not be troubled." And that's John 14:1. I drop Philippians 4:6, where it talks about worrying about nothing. Don't worry about anything, but in everything through prayer and supplication, make your request known to God, and let the peace which transcends all understanding guards our hearts and minds on Christ Jesus. When you're facing a tough decision, like which medication to take, uh, you can pray, "Not my will, but your will." God's voice and is in whispers. One of the things I want to remind you and is that, remember, let's see, there's a beautiful lady, a young woman, and there's a witch. Although this isn't coming out very well, but there's two ways to look at everything. And if we are really, to get to be at peace, is to be in the worst situation and find beauty in that. Uh, if we don't, we live in fear. We live in fear. We dread the future. We dread things that may not come to pass. Just live in today, trust in God, love each other, look up instead of out. We are all servants of Christ, and again, I'm just a placeholder. I'm here because I promised to be here, so you can interact with each other. If God can use me to facilitate you getting answers, I'll do everything possible. If you notice on my YouTube channel here, I have never, from the beginning, put a commercial. I have not made a dime off of any of this stuff. No, because if I did, then it wouldn't be tithing. I tithe my time as a servant to Christ, and also just to comfort and love all of you. If with my experiences and with each one of your experiences, if we can share and we can, then together we've all had MS, and people, we're part of this body, and it can, I don't know. All right. And my pains can help prevent your pains. Uh, yeah. And Chris is saying fear is a liar, and fear is false evidence appearing real. And I'm going to here's some questions to ask yourself. Do I forgive myself and others for the mistakes made in the past? Do I waste today paralyzed in fear and anxiety of a situation that may not occur tomorrow? Do I recognize and appreciate the contentness of the blessings I have without wanting more? I got to get away from Amazon because. All right, question. Do I entertain the possibility that I may blame others for the offensive behavior that I sometimes commit? Do I respect my body as God's temple by keeping it clean and nicely dressed, eating wholesome foods, and by exercising it to the best of my ability before turning to drugs? See, I gotta, you know what? I need this list because you know what? I'm a hypocrite. I need this, so I have rules to follow. Do I respect my mind by challenging it with new things to learn and by reading something that requires effort, thought, and concentration? Do I require others to understand me in order to feel valued? Do I feel alone in life, or do I recognize love, comfort, and understanding that God provides around me? Do I rely on my abilities to create happiness only to be left wanting again? That's chasing things that temporarily make us feel good. But I'll tell you what, our comfort, our hope comes in how God provides for us through each other, through us acknowledging what's beautiful in our life, not necessarily wanting more. I need to. You know what? I should have given Amazon up for Lent. I need to do that. All right. So if you don't know what it's like to be comforted in where you're at, ask Jesus. You know, the Lord said, anybody who asks, He will. He'll come into your life. All you have to do is ask. Every single person. So all you have to do is say this prayer and invite Jesus in your life, and you'll see amazing things. All right. So I've got so many glasses here. So just say this prayer after me. Dear Lord, I have failed in life to achieve the peace that I hear you provide. I recognize that pride has blinded me from your ways. I know that I'm a sinner, and I ask for your forgiveness. I believe you died for my sins and rose from the dead. I turn from my sins and invite you to come into my heart and my life. I want to know you and that peace you bring by trusting you as my Lord and as my Savior. In your precious name I pray, amen. So you know what? So anyway, if you just said that prayer, welcome. You are a brother or a sister. If you haven't, if you know you just you're not there, that's all right. You don't have to love God for God to love you. And work. I believe you're watching this because you have this disease and God brought you to get some sort of comfort and advice and love. And we have that for you. We have the, and it's not just me. I'm just the face. I'm the shiny object that goes on. Jane and Chris and Patricia and Andrew and Gina and where's Karen? You know, and Sharia. I love you more, Sharia. But all of us, we all have to support each other. And your words have helped me. And it's important. As much as you thank me for helping you, I need to thank you. I need to thank each one of you. And Richard, oh my God, Richard, of course, you. I need to thank, and Robert, and and Dennis. I need to thank each one of you for touching my lives and keep me going, keeping me going. It's amazing. It's amazing. But it's been, let's see, since 11:58 over there. But I guess I started early. So what I wanted to tell you is go. Please follow me if you see this and you're on Facebook. If you may want to go to YouTube and subscribe to Dulci Hill, my channel, and there's a lot of helpful videos. Uh, and by the way, Sharia sends all of you guys a message that she loves every one of you on YouTube. So she, I guess either or, you can watch on Facebook, but it's not as interactive as YouTube. So if you're watching that on YouTube, please subscribe to my channel. Go to msfrontiers.org. Uh, uh, Look at what we have for you. I love you all. May the Lord bless you and keep you. May He shine His face upon you and be gracious to you. May the Lord lift up His countenance upon you and give you His peace. I will see you. Oh, you know what? Didn't I tell you guys, real quick, didn't I tell you guys I was going to show you how I ruined my earrings? Notice how right here it's flat. You can't see, because I drop everything. I drop everything. But how important is anything? Love you guys, and we'll talk on Thursday, right? Bye.